Connecticut Children's Medical Center has joined 65 hospitals across the country, urging officials to protect children as the nation sees a rise in pediatric COVID-19 cases.
We are speaking with the president and chief executive officer, James Shmerling, and thank you so much for joining us today. The first question has to be, why did the Children's Hospital CEOs come together to put out this call to action, and what are you asking people to do?
Well, I think, first of all, there's a sense that children have not been adversely affected by COVID, and that is truly it's not true. It's a misconception. So we want to educate the public that the children are in jeopardy, and we need to do something about that. And the call to action is get all eligible populations vaccinated, including children that are 12 and up. And when the approval comes out for children younger than 12, get those children vaccinated. Secondly is to mask. I know that's controversial, but we know science has proven that children who are wearing masks, when adults are wearing masks, we protect ourselves and we protect others. And as children go back to school, it's critically important that they and the adults around them are wearing masks. And then third, the social distancing and washing hands, which is the message that we've been all hearing for the last 18 months. These are all effective strategies to try and protect children. And as adults, it's really our obligation to try and keep children safe.
So, Mr. Shmerling, from your perspective there, Connecticut Children's, how is the Delta variant impacting children?
Well, I think a couple of ways. One, certainly in the South, you're seeing a whole lot more of the COVID, higher acuity and children being admitted into the hospital. We haven't seen that in the New England area as much. We are seeing children with COVID being admitted to hospitals, but not to the levels in the South. But we are seeing a lot more RSV, which is a virus we typically would see in the winter, but because children were wearing masks and were protected all last year, as they go back in the public, people have taken off their masks, they don't have the built-up immunity, so they're now getting RSV. And I think that a really tremendous impact that we're seeing is on mental and behavioral health. Social isolation, the stress that their families are going through are significantly increasing the demand for our services for mental health. In the emergency department, we're seeing children who are harming themselves and ending up in the hospital. And we're seeing numbers that almost have doubled since last year.
Wow, that's disappointing to hear that that's the outcome of all of this. You know, it also begs the question of why is it so important to advocate like you are on behalf of all the children really that are in our lives?
Well, I think we, as well as the other children's hospitals across the country, are recognizing that kids people don't believe that they're as in jeopardy as adults. A lot of the emphasis in the public policy has been around adults. And we think that children need to be front and center of health policy, about the support that the federal government is giving, the state government is giving, and recognize that children are very vulnerable. And while they may not, at least in the New England area, be as significantly impacted by COVID itself, the mental health issues that it's raising are epidemic, and it's something that we need to pay attention to and take action.
All right, James Shmerling, President and CEO of Connecticut Children's Medical Center, thank you for joining us. We hope people take your message to heart.
Thank you, and thanks for helping educate the public.
All right.
Appreciate it.
All right.